So I chose to do chapter 13 on intimate partner violence and motivational interviewing. So, chapter 13 starts off with discussing how intimate partner violence is actually a major public health issue. So, a lot of people may not consider it that way, but it does impact the public at large. It can include not only physical violence, but also verbal and psychological. There's two different categories of intimate partner violence. The first is called intimate terrorism, and that's probably what most people think about when they think about domestic violence. It's typically perpetrated by males, it's unilateral in nature, it's physical, and it's combined with controlling and abusive behavior. But there is another type of intimate partner violence called situational couple violence. And with situational couple violence, it's typically non controlling. It's bilateral or bidirectional, which basically means both partners are perpetrating the violence. And typically it's an outgrowth of conflict. So maybe a conflict occurs as the argument ensues and gets worse. Then the couple begins to physically or verbally assault each other. Um, and the treatment approaches are different depending on those two types. So it's really important to understand which type you're dealing with. The usual treatment for intimate partner violence would include group therapy, couple therapy, and obviously universal prevention. The problem with the usual treatments, typically, usual treatments are court ordered. So when things are court ordered, there tends to be a low desire or motivation. People tend to be ambivalent towards the therapy. So that can create an issue when people are going to therapy to deal with intimate partner violence. So that provides the rationale for why we would introduce motivational interviewing into the therapy session. So, with motivational interviewing, as we've learned, it's utilized when you have people who are ambivalent to treatment. So, again, court ordered treatment is a perfect example of when people are being forced to be there that aren't necessarily wanting to be there. Um, what's recommended is not necessarily to do motivational interviewing alone, especially if there is an indication that there is a high chance of violence that's going to occur between the partners. In fact, in that case, they recommend you don't do motivational interviewing alone. But instead, motivational interviewing is more commonly added to the current treatment they're receiving, whether that's group or couple therapy. So it's recommended as an extension of treatment. Um, the reason that we use motivational interviewing again is to begin to move people towards finding a motivation for being there, eliciting change talk, so including questions that would relate to the specifics about um, the violence if they're willing to talk about it. And then once you work through the feelings of what happened and why they happened, you can move into discussing how that person will implement change. So, evaluations on whether motivational interviewing is effective or not have been done, but it's more of a short term. Uh, they've they've evaluated that more on the short term. So they have found that um, it is impactful on the short term, but long term studies are not haven't really been done in a large enough number to know how this will be impactful long term. Um, we do believe that motivational interviewing is more impactful because the interviewer comes across as empathetic and non-confrontational. And again, when people are introduced into court-ordered therapy for something like intimate partner violence, their expectation is they're going to be confronted with judgment, and most likely a therapist that wouldn't be empathetic to them. So by coming across as empathetic and non-confrontational, that builds rapport with the client, allows them to open up, and allows the motivational interviewing process to help elicit that change talk and elicit change. Again, in the short term, 6 months or so is what they've done a lot of studies on. It tends to decrease the amount of intimate partner violence, but there's a lot of questions regarding the long term. And in fact, um, what they do know about the long term implications are it's not effective as a long term treatment. So I hope this was helpful. Thank you guys.